We always say each session is different, and it's never quite the way we predict it's going to play out, but this one really was unique. I think we really did make a commitment to get at the THA offices in person as quickly as possible and get over to the Capitol as quickly as possible, and I think that served us well.
Following a year of uncertainty and stress, the hospital industry hoped that the 2021 legislative session would provide an opportunity to focus on important healthcare issues with limited political posturing. While the session may have begun that way, tranquility and order rarely last to sine die. A global pandemic put the work of Texas hospitals in the spotlight, and the Texas Hospital Association's policy priorities focused on strengthening the state's healthcare infrastructure to meet the healthcare needs of all Texans. THA advocated on behalf of its members, reminding lawmakers the grace and resilience hospitals showed under the pressures of a pandemic.
When I talk to my colleagues in other states, we are clearly doing a better job at dealing with this pandemic at all levels.
When the session kicked off, the state had fewer funds available to spend than originally projected. However, as vaccines emerged, hospitals hit the ground running to vaccinate their communities. The state's economy quickly made a comeback, largely due to Texas hospitals' heroic vaccination effort. Despite the challenges, uncertainties, and turbulence, Texas hospitals secured numerous victories in the state budget. The desire to protect patients and fund the significant role of hospitals was top of mind for lawmakers.
We very much appreciate the inclusion of the add-on payments for trauma, safety net, rural hospitals. We appreciate continuing the add-on payment for labor and delivery services for rural hospitals. Great discussion about that earlier.
Overall, lawmakers fully funded the state's Medicaid program, including rates for hospital services. Medicaid was funded at $25.1 billion in general revenue, or GR. That is a slight increase of about $500 million in GR over the previous biennium. Lawmakers also held level funding for hospital rate enhancements. This includes existing rate enhancements for trauma services, safety net hospitals, and rural hospitals, inpatient and outpatient services. An additional increase of $48 million in GR was added in the final budget for rural hospitals' Medicaid rates, so that was a big win for them.
Outside of hospitals' funding successes, THA pursued and secured several legislative wins for our members. This includes liability protections for healthcare providers, solutions to help preserve hospitals' ability to dispense certain drugs, and the ability of hospitals to be able to require staff to be immunized against vaccine-preventable diseases.
This bill would prohibit the use of what may be the most effective tool a hospital has available to it the next time the healthcare system is threatened with collapse by an out-of-control disease.
Yesterday on the Senate floor, Senator Kolkhorst did put language into amended on to 968, which basically says hospitals can continue to require our employees to be vaccinated, but no other employer in the state can be outside of healthcare.
One of the most significant events that transpired during the legislative session was Winter Storm Uri and the subsequent failed power grid that had widespread consequences across the state. THA championed the needs of Texas hospitals and patients during yet another unprecedented crisis. Amid the winter storm, THA worked with member hospitals and legislators to draft and file legislation to help patients receive their routine dialysis in emergencies.
Harry and I worked really hard to quickly draft and file legislation, which we achieved in about a 24-hour period from getting a draft out to getting it filed. Incidentally, while neither of us had power or water, and I drafted it in a hotel lobby.
Following over a year of devastating loss and illness caused by the COVID-19 pandemic, Texas hospitals strongly supported efforts to increase the number of Texans with comprehensive healthcare coverage. THA launched a targeted grassroots and digital advocacy campaign to educate state lawmakers and the public on the need for coverage expansion. While full coverage expansion did not come to fruition, Texas ultimately moved to improve coverage for postpartum moms, children, and prescription drugs.
I think we put enough political pressure, certainly on the House, where the Speaker came out and said, in lieu of full Medicaid expansion, we should still support the coverage of moms 12 months postpartum, and that bill very quickly left the House floor with broad support. There was a bill that would have created continuous eligibility, Medicaid eligibility for children. That's something we have done for the pandemic, and we wanted to make that permanent so we wouldn't have that attrition because of those administrative burdens. Again, that bill very quickly moved across the House floor.
Now, postpartum moms have coverage under Medicaid for 6 months. Kids under Medicaid have fewer eligibility checks, and there's expanded access to discounted drugs for the uninsured. In the midst of this work, another challenge emerged. The federal government announced it had rescinded Texas's 10-year Medicaid 1115 waiver extension. THA quickly responded, articulating the extreme impacts this would have on hospitals. This is an ongoing issue, and THA rallies awareness and support for an extension.
We've been working behind the scenes with HHSC and the governor's office on the waiver, and with the congressional delegation, keeping them briefed. And HHSC resubmitting the waiver, I think, is probably the most logical path forward.
Despite these surprises and challenges, THA advocacy experts seamlessly balanced hospitals' COVID-19 response while strongly representing hospital interests at the state capitol.
We're real focused on the fact that hospitals are a tightly regulated industry, and there is a lot of flexibility in terms of state statute and rulemaking, regulatory rulemaking that have gone into our response and are necessary for us to be able to respond quickly and effectively as we have. And so we're trying to make sure that those protections exist. We're also looking at issues related to data, those items, people really wanting to know so much from hospitals in terms of what we were doing and how we were doing. And so we're trying to preserve and harden those lines of communication for the future. We don't want to start thinking about the next pandemic, but we certainly need to try and plan for it.
Whether in Austin, Texas, or Washington, D.C., the Texas Hospital Association continues to be a leading advocacy voice for hospitals, healthcare workers, and the millions of patients who depend on them.